In discussions about plasma cell disorders, MGUS often sits in a confusing middle ground. It's not cancer, and yet it isn't entirely benign. The core idea is simple. The body is producing a monoclonal protein, an M protein, made up of many identical antibodies from a single clone of plasma cells. The amount is small, there's no organ injury, and people feel completely well. That's the paradox. MGUS itself doesn't require treatment, but it carries a steady, lifelong chance of turning into something more serious. From that starting point, the goal at diagnosis becomes crystal clear. Clinicians must rule out overt myeloma, look carefully for evidence of organ damage before it advances, and then decide how closely to watch the patient over time. As the conversation moves from concept to definition, MGUS becomes easier to pin down. It's formally diagnosed when the monoclonal protein stays under 3 grams per deciliter. The bone marrow plasma cell clone remains below 10%, and there's no trace of the classic Crab findings: hypercalcemia, kidney injury, anemia, or bone lesions. Surprisingly, MGUS is common. Roughly 5% of adults over 50 have it, often discovered incidentally. And while the risk of progression sits at only about 1% per year, that risk never fully disappears. Because the disorder is defined by what it isn't doing, precise laboratory work becomes essential. Every patient needs an SPEP to quantify the M spike, immunofixation to determine the heavy and light chain type, and a serum-free light chain assay to identify light chain clones or flag early amyloidosis. Together, these tests reveal not just what the protein is, but what harm it could cause. The next step brings in the Mayo Clinic risk model, which helps frame the future. 3 variables drive risk: an M protein level above 1.5 grams per deciliter, a non-IgG isotype, and an abnormal free light chain ratio. Someone with none of these factors faces only about a 5% risk of progression at 20 years and often doesn't even need an initial bone marrow biopsy. Someone with all 3 faces a much steeper path, close to 60% over the same period, and benefits from annual monitoring. But MGUS becomes more than MGUS when the protein itself starts injuring tissue. That's where monoclonal gammopathy of clinical significance enters the picture. These cases look quiet on paper, but the protein deposits into organs, triggers autoantibodies, or activates complement in ways that cause very real harm. When this happens in the kidneys, the condition is labeled MGRS, and the result can be progressive glomerular injury and eventual kidney failure. Other organs can suffer too, manifesting as neuropathies, cryoglobulinemia, or scan disease. In these situations, treatment targets the clone directly, often with agents like daratumumab or bortezomib, to halt further damage. This broader landscape naturally leads to 2 closely related but distinct conditions. Smoldering myeloma sits between MGUS and overt myeloma, marked by an M protein of at least 3 grams per deciliter or bone marrow involvement above 10%, but still without Crab features. Here, the risk of progression spikes early, especially in the first 5 years. And then there's AL amyloidosis, the disorder where misfolded light chains twist into sticky fibers that accumulate in organs such as the kidneys, heart, and nerves. Not every light chain behaves this way, but when they do, the consequences can be profound. It's equally important to separate AL amyloidosis from conditions that may look similar under the microscope but arise through completely different pathways. ATTR amyloidosis stems from transthyretin, often affecting the heart in its wild-type form, while AA amyloidosis arises from chronic inflammation and tends to damage the kidneys. They share the concept of amyloid deposition, but not the mechanism behind it. Taken together, the story of MGUS is one of nuance. The condition itself is quiet, but the implications ripple widely. Understanding what the protein is doing, why it formed, and whether it is harming tissue allows clinicians to distinguish harmless from dangerous and to act early when the stakes rise.